University Health Network is made up of 3 hospitals: the Toronto General Hospital, the Toronto Western Hospital, and Princess Margaret Hospital. We look after patients with diabetes, complex elderly patients, patients with heart disease, neurological disorders. We do surgery of the most technically advanced type. We have global impact. What we do matters.
Patient care, research, education are all important facets of our international and national impact.
Since the first administration of insulin to diabetic patients at Toronto General by Dr. Bending and Dr. Best, insulin injection has been used worldwide to treat diabetes.
We've been leaders in the field of neuroprotective trials beginning in the middle 1980s, and we've been leaders in a number of surgical therapies. We then followed that with work in deep brain stimulation.
And we have a huge postgraduate training program where people from all over the world come to train and learn cutting-edge techniques here at the Peter Mount Cardiac Centre.
That's the only way in this day and age that you can be at really the cutting edge, pardon the pun, the cutting edge of surgical cancer care, is to have global collaboration.
So what we're doing here is called telesimulation, and we're meeting with surgeons in Botswana, Africa. We're trying to teach them minimally invasive surgical skills using simulation technology. And ultimately, we'd like to actually be able to teach them real surgeries here from our own ORs.
So when we talk about global health, we're really talking literally about global health. Most of the people live under conditions where infectious disease, for example, is a major cause of illness and death. I think we can make a difference if we can harness some of the innovation and apply it to some of these really massively important problems.
We do patient care at the highest level, and we're able to teach this level of quality of care around the world.
One of the things is trying to get palliative care more involved in non-malignant illnesses. I'm looking at what are the barriers to that, how do we improve patient access for those illnesses.
In the emergency departments at UHN, there's the exciting program of treat and release. As soon as they step in, there's a designated area, there's a set wait time, there's designated people who treat them, and then that's what they're terming treat and release.
Patient portal is just being rolled out to our patients. It's a website which allows access to personal health information, diabetes information, as well as educational materials.
Home hemodialysis in some other countries does not even exist.
When I went into kidney failure, basically I was not able to hold down my job anymore because being on the dialysis in the hospital. The other situation was the doctors had told me I couldn't have children.
I think we're making a difference. I'm proud to say that our team is able to push the envelope and challenge what was previously thought was not possible.
Sure enough, then I conceived Matthew. I'm able to work, take care of my kids, and it's just an amazing program.
It's really a whole team that really works cohesively together to try and better the outcomes of our patients.
And this is where philanthropy has been critical, particularly to our recent success. For example, in cardiology now, one of the most exciting things is the percutaneous replacement of valves within the heart.
This particular way of taking care of valvular heart disease is really advantageous, and it's really the difference between suffering until death or a new lease on life.
There's no question that we are at the leading edge in the development of technologies here at the University Health Network. Supporting this kind of research and development in high tech is incredibly expensive.
Further funding is critical to seeing ongoing advances in all of these fields.
Perhaps design new types of stem cells which will make insulin so that they could lower blood glucose levels independent of insulin injections.
Money is always hard to find, and we do a lot with money that's donated to our program.
You know, these types of procedures really can change someone's entire outlook for the rest of their life.
I'm very grateful for the funding because it's allowed me to have this program that I do at home and basically let me have my life back.
What happens at UHN
matters.
UHN is achieving a global impact.
What happens at UHN
makes a difference.
UHN is making a difference.
UHN is making a global
impact.
UHN is making a global impact.